IUI is also known as Intrauterine Insemination, and it's a form of fertility treatment that involves putting sperm into the uterus in order to achieve pregnancy. And the reason for this type of treatment is in cases where sperm doesn't get to the uterus. So that would be for cases in which there isn't a male partner, there are issues with intercourse, or the sperm is of mildly suboptimal quality. And the sperm is put into the uterus around about the time of ovulation. Ovulation can either be natural or it can be induced with medication. Prior to deciding whether somebody is suitable for intrauterine insemination, we would want to check whether they were ovulating or not and decide whether they needed ovulation to be induced. And the other important thing is to check that the fallopian tubes are open so that the sperm can get to the eggs. The success rate of IUI is between 9 to 15% per cycle, depending on whether it's a natural cycle or a drug-induced cycle. Compared to IVF, it's lower per cycle, but it's less invasive and less costly. And I think those are the advantages of IUI. The number of cycles that we would consider in the first instance would be at least 3. And if we're not successful after those 3 cycles, then consider maybe moving on to another form of treatment.